Greetings, everyone. My name is Shema Abulbaha, a research assistant from the College of Pharmacy in Qatar University. Today, I will present a research poster on behalf of Dr. Monica Zolezzi, an associate professor from the College of Pharmacy in Qatar University, and is also the principal investigator of this work. Authors of this research are Waad Elamin, Iman Ashraf, Shorouk, Doaa, Mahmoud, and Dr. Athar Elhakim. The poster is titled as Content Validation of an Algorithm for the Assessment, Management, and Monitoring of Drug-Induced QTC Prolongation in the Psychiatric Population. Now let's start with the background. QTC interval prolongation leads to serious complications, and assessing the risk of QTC prolongation in the psychiatric population is particularly important because they are exposed to multiple medications known to increase the risk of life-threatening arrhythmias. This presents a challenge for all clinicians in the treatment process of their patients, and in order to address this issue and assist clinicians in the treatment process, an algorithm was developed based on a thorough literature review for the assessment, monitoring, and management of drug-induced QTC prolongation in the psychiatric population. So the objectives of this research was to determine the content validation of the algorithm for the assessment, management, and monitoring of drug-induced QTC prolongation in the psychiatric population. And in order to achieve those objectives, the authors used the methodology represented here in the poster, and they used the purposive sampling technique to identify their potential sample, and they used their target population was mental health practitioners that was composed of pharmacists and physicians. And the authors conducted an anonymous self-administered survey that was embedded in an online orientation module about the algorithm, and it was given to mental health practitioners. The survey comprised quantitative component for the estimation of the content validity index for each step of the algorithm, and the qualitative component to assess mental health practitioners' feedback about the algorithm. And this part was analyzed using the word clouding approach. Now, moving to the results section, for the quantitative part, as shown here, the results showed an average mean content validity index score ranging from 3.68 to 3.86 out of 4 for the appropriateness, and 3.68 to 3.81 for the safety, and 3.5 to 3.77 for the reliability of references used in the algorithm. And for the individual item content validity index analysis, it indicated high validity of the algorithm as it scored 0.86 to 1 for all the decision statements in the three aspects assessed, which are appropriateness, safety, and reliability of the references used. Now, moving to the open-ended question results as represented here on the right side of the poster. The open-ended questions result indicated that mental health practitioners supported the implementation of the algorithm in practice. However, they recommended simplification of the steps and provision of the online orientation module for training on its use. And now moving to the conclusion section, results of this study validate the steps in the algorithm and suggest that its implementation in practice may prove to be useful tool in assisting mental health practitioners in the decision-making process at the time of prescribing medications with the risk of QTC prolongation, especially for the psychiatric population. This brings us to the end of this presentation. I will be available during the poster session in the mental health conference in Abu Dhabi. I would welcome all your feedback and all your questions, and thank you so much for your kind listening.